My name is Nils Hamnerius. I'm a senior consultant at the Department of Occupational and Environmental Dermatology at Skåne University Hospital, Malmö, Sweden. I would like to present our study, Wet Work Exposure and Hand Eczema among Healthcare Workers. Hand eczema is common among healthcare workers. Wet work exposure, especially to soap and water, is considered to be a major risk factor for occupational hand eczema in this group. The hands are subject to changing occupational exposures due to introduction of hygiene regulations that emphasizes the use of alcoholic disinfectants and disposable gloves. The aim of this study was to assess the amount of wet work exposure, the occurrence of hand eczema, and possible associations between hand eczema and occupational wet work. Especially, we wanted to see if hand eczema was associated with the use of disposable gloves and/or alcoholic disinfectants. We constructed an electronic questionnaire that was distributed to all hospital employees in the region of southern Sweden. Respondents reporting a profession as nurse, assistant nurse, or physician were defined as healthcare workers, and they constituted the study group analyzed. Almost one-third reported hand washing with soap more than 20 times daily. 45% used alcoholic disinfectants more than 50 times daily, and more than 50% used disposable gloves for more than 2 hours per day. The one-year prevalence of hand eczema found was 21%, which is higher than what has been reported in the general population in Sweden. This study shows that there is a considerable amount of wet work exposure in healthcare work and that hand eczema remains a common problem. Furthermore, it shows that in a healthcare setting, the time spent working with gloves is associated with hand eczema in a dose-dependent way. On the contrary, the use of alcoholic disinfectant is not associated with hand eczema. Thus, keeping time with gloves short and replacing soap and water with alcoholic disinfectant whenever possible is to be encouraged.